Hey everybody, it's Mrs. May, and I'm here with the board and some of our admin team. I just want to thank you for joining us tonight. I'm going to start off with just welcoming you all in, and then I'm going to give you some rules of how this is going to go. So first, I want to thank a couple of people. Thank you to Carson Keys, who is behind the scenes as always, and he's running our YouTube live event tonight. This is our very first one, so just prayers that everything goes exactly the way it's supposed to. Secondly, I want to give a huge shout out to our community. We've received so much encouragement from you, notes that you're praying for us and thinking of us, and just wishing us the best. So we just want to thank you for being so great and so patient and so flexible as we try and work through all of these different scenarios. Your prayers have been felt and they're appreciated. And then last, I want to thank our teachers who have also, just been so gracious at trying to figure out the different changing guidelines, who are working through what to do now that some of their kids may be in public school. They are dedicated to being here on day one, and they have been up here every day doing what needs to be done so that we can see you guys on the first day of school, August 17th. With that said, let me give you one little rule that we're going to ask you to follow. The first portion of this YouTube live event will be information. We're just going to try and go through all of the things that you've asked to know more about. So we're going to do that first, and then after all of that is done, we're going to ask you to submit your questions, and you can do that through the chat. So if you'll just hold those questions until we're done with the information, that way we'll be able to answer them in order and we won't miss any of them. So now I'm going to pass this off to Miles Freeman, and he is going to pray to get us started.
Let's pray. Dear Heavenly Father, thank you so much for letting us gather here this evening. Lord, we pray for our nation. We pray for our great state of Texas as we are in these interesting times. Lord, especially we want to just come to you with a prayer of request, Lord, for guidance, for wisdom, as we enter into our exciting 2020-2021 school year. Lord, we want to pray for protection for our students, for our teachers, Lord, for our parents. Lord, we're grateful that we have this community that's called Legacy, where I'm thankful for my friends and all the kids that we get to interact with throughout all the days of the school year. Lord, I pray just a special protection for us as a school this year as we go forward. In your name I pray, amen.
Amen.
Again, I'm Miles Freeman. My wife Jennifer and I have been at Legacy for 12 years, and we have 4 daughters here at Legacy.
Good afternoon, my name is Casey Clark. My wife Judith and I are starting our 7th year as the part of the Legacy family, and we have 2 children that are part of the school.
Good evening, I'm Michelle Keys. I have also been at Legacy. My husband Kevin and I have our 2 children here. We have been here 7 years, and I'm just extremely grateful to be starting this year with Legacy and Audra's leadership.
Hi, I'm Chad Jolly. My wife Amy and I have been here for 6 years. We have 2 great kids in elementary and middle school, and we're just excited to start a new year with our kids learning and excelling here at Legacy.
Dan Conley, chairman of the board. My family has been here for 14 years. We have 2 kids here currently at Legacy. I would like to take a moment and just thank Audra for her leadership and the staff for the endless and tireless hours that the staff and the faculty have worked on this situation and what we look forward to doing. Audra and her team have the full support of this board, and will continue to have that as they move forward, and we're looking forward to the start of the school.
All right. Well, you've gotten to meet our board, and you've heard a little bit about them, so we're going to go straight into the next little phase of this and probably talk to the person that's going to have most of what you want to hear. A lot of the questions have been about what our policies are going to be around how we're going to report who gets COVID, what do we do when that happens, and on and on and on. So the next person that I'm going to ask to speak is Tanya Harrison, and she is our health services representative here tonight, and so I'm going to let her answer some questions for you.
Hi, I'm Tanya Harrison. I am a licensed and certified physician assistant by training. I work here in health services and have done so for several years now. And so this is just a new and exciting phase of school health services that we get to wander through this year. I want to just start out by saying that I work with a wonderful team. I have Miss Joanna Prazak is a registered nurse, and Miss Judy Bailey is also a registered nurse. They will be here on campus. Usually there's going to be 2 of us here. Sometimes there will be 1 with a staff assist. Miss Angie Gerald has been with us for several years now, but she took a university setting position. But her kids are still here, so she will likely volunteer in health services numerous times during the school year. I do not practice as a PA in the school, obviously, but that is the experience that I draw upon. I'm also not an expert in all things COVID. However, I will tell you that I read and devour as much research and on policies and the medical aspects and all of that as much as possible every single day. I often assault Miss May's email account with all of the things that I have found. Even the experts out there in infectious disease will tell you that we get new information literally every single day regarding this virus. So nothing that is really written down at this point is final. I feel a little bit like I'm nailing Jell-O to a wall most days, or like Lucy in the football, like every time we get ready to kick it, it moves on us. So I just want you to know that we are working to change as much as we can as the information that comes in warrants it. But we had to start somewhere. So this is what we're doing. I look at everything from a medical aspect, a public health aspect, from a school and education aspect, but also as a mom. I had 3 kids here at Legacy. My first one graduated already, but then I also have a 10th grader and a 6th grader here. So my kids will be in the school as well. There is nothing that we can do inside the school except for mitigation, meaning that we will try and prevent as much spread as possible. But nothing is foolproof, short of having everybody live in their own individual bubble. So, with that said, we are going to rely on parents a lot this year to not send their children to school sick. We're going to go through screening that's going to require us to self-screen as parents before the kids even get to campus. And the reason that we do that is because we've been told that it's better to not screen the children inside the campus, because if they are positive, then you've just exposed the people that were around them. So basically we need to know that you've looked at your kids, you've taken their temperature, you've looked through the list of COVID symptoms that we're going to send you, and my kid does not have any of these things recently developed, or that is not abnormal to their normal everyday life. Things such as fever above 100 degrees, or feeling feverish, or feeling chilled, new onset or a persistent cough, shortness of breath and difficulty breathing, obviously, fatigue, muscle aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea. So most of those things we would expect you not to send your kids to school with anyways, but some of them are very, very generic. So we live in one of the biggest allergy areas in the nation. Mm-hmm. So we're gonna have a lot of kids with runny noses. We're gonna have a lot of kids with congestion. That's gonna require conversations with health services, and we're gonna have to use our clinical judgment as to whether that's a good idea for your child to be in the classroom that day or not. That's all we can do really to try and prevent any spread within the classrooms as far as screening is concerned. The TEA and the CDC do not require us to screen in the school. They require self-screening outside of the school. So I just wanted to let you know we didn't make that up off the cuff. That actually comes to us from those guidelines. If we have a confirmed case within the school, health department guidelines tell me that the people that are considered close contact with that student up to 48 hours prior to the positive test or the onset of symptoms will be the ones that will need to quarantine. So close contact is defined as being within 6 feet of that person for more than 15 minutes without a mask on. So that's the criteria that we're going to go by as far as who needs to be quarantined and stay home for the 14 days. And that's the 14 days from the last exposure to that student or that teacher. We're gonna do our best to not have that kind of situation happen very often. We have done our best to space out the desks as far as possible within the classrooms. The TEA says that it can be anywhere from 3 to 6 feet is the optimal range. So I can promise you that we've been working on getting these desks and these chairs separated by 3 to 6 feet in every single classroom. We are going to ask students from 6th grade and up to wear a mask. From the state of Texas mandate does not say that people under the age of 10 need to wear a mask. So that for us is going to include 5th grade and younger. If you want to wear a mask or you want your student to wear a mask, you can wear a mask. We're not going to rip any masks off anybody's faces, but the ones that will be required to wear a mask are going to be from 6th grade and up. Teachers will wear a mask and or a face shield, and they will stay 6 feet away from students. If they need to be closer than that to students, then they will probably ask the student to wear a mask if they're not already wearing a mask. And that's just what our guidelines are going to say at this particular time. If you have been diagnosed with COVID, or anyone in your house has been diagnosed as COVID positive, the health department tells me that everyone within a household is considered positive. So you can't send the sibling to school. You yourself and your entire family, the one that will all be considered positive. You all have to stay in for the following criteria. So it has to be at least 10 days since the onset of symptoms or the positive test. It has to be at least 24 hours since you've had a fever without any fever-reducing medication, and your symptoms have to be improved. For any family members that are not COVID positive, they're just considered COVID positive, but for any family members that are not tested COVID positive in the household, if they develop any symptoms, the timeline starts over from there. So that's what the health department has told me. Who needs to be notified? And that, I think I already covered that, but who needs to be notified is going to be those that fall in that criteria of less than 6 feet for greater than 15 minutes without a mask on. And so the health department will be the ones that tell us definitively who needs to be quarantined. As far as who needs to be notified, that's a little bit of a sticky situation. None of these things match exactly. So the TEA guidelines don't match the CDC guidelines, don't match the AAP guidelines. None of them really match completely. TEA says that the entire school needs to be notified. The health department told me it's just the class and those that are considered a high-risk contact. So we're going to have to decide on what that's going to mean. We are a small school population, so probably it will be on the level of elementary school, middle school, and or high school that has to be notified. But since we have siblings all over the school, it probably will end up being everyone will be notified. Let's see, what else are we doing? Ms. May has already sent out all the different things that we're doing around the school campus. So we have hand sanitizer stations everywhere. Teachers will be emphasizing hand sanitation and washing hands. We're limiting the number of people that can be in the bathroom at the same time. Masks will be on in the hallways as they're transitioning between classes. Those kind of things are what we have already set out. The cleaning will happen every single day. It will happen in between classes. Obviously, if we have someone with symptoms throughout the day, then everywhere that that person has been will be sanitized as best as possible. So what happens if your student comes down with something during the school day, starts feeling poorly or whatever? I can tell you that the teachers are going to be on high alert for looking for any of that. So they will have a way to notify us in health services that they have someone that they want us to check out. The student will be put in a mask if they don't already have a mask on, and then we will escort them to the clinic. In the clinic, we are building an isolation area. It's not a negative pressure room with its own ventilation and all that kind of stuff. It's going to be just an isolation area to keep any students that are symptomatic or any staff that's symptomatic away from the students that come to our clinic for other things like medication or to have their something checked out, so, or come to ask us a question. So we're trying to keep those that are symptomatic separated from those that aren't. So anyways, they'll be escorted to the clinic. We'll put them in the isolation area. One of us will be in there with that student, while the other person is able to see any of the well students that come in and need our assistance. If we evaluate the student, see that they are feeling poorly or they meet any of these criteria, we are going to call you, just like we would call you for any of these criteria anyways. It is very important that you come and get your child within an hour of when we call you. So we are just asking that you do whatever you can to come and get your student out of the student population as soon as possible if they're feeling poorly. So we will do our best to keep the student isolated from anyone in the hallway on their way to the front desk. Obviously, social distancing or physical distancing is going to be very important in all of this. I think that's, is there anything else you want me to cover at the moment?
I think that was it.
Okay. All right, that's all.
I'm sure we'll be circling back around to questions for you, Tanya, looking at the screen already. All right, it says on there that they're not able to hear us, so if you guys will just try and speak up. I know we've got several mics in here, so just speak up so they can hear you. All right, I think next on our list is Clint McDonald, and he's going to give us a TAPS update.
Thank you, Mrs. May. As many of you have already heard, our fall sports have been backed up until the week of September 7th, which is good news. We were a little bit worried that things might get canceled. So what does that look like for us? So from the dates of August 3rd through September the 6th, we have no interscholastic competition, which means no scrimmages, no contests, no games, no tournaments. Our summer rules do remain in effect until the first day of school, which is August the 17th. Once our school starts, what kind of activities can we do with our fall sports? They include, you can do strength conditioning, you can have sport-specific workouts where you can use volleyballs, footballs, etc., and film study. For our off-season, for basketball, baseball, softball, etc., you still have the 1 hour per day max that you can practice during the fall. A couple of key dates as far as transfer deadlines. Our senior transfer deadline is August 17th, which is their first day of school. And then everyone else for a fall sport is September the 8th. Some of y'all have been asking about junior high. Junior high will have sports as well. We're just backing them up to the same week as TAPS is done. So football, volleyball, cross country, they will be able to start their practices then. They will be able to practice in their athletic periods once school starts. So once again, everything has been backed up until the week of September 7th. And as I get changes, I will let you know.
Would you mind covering some of what you're doing mitigation-wise
Yes.
at the workouts and weight room and things like that?
Yes, so as we continue to do workouts, we're keeping our kids social distance as best we can. Kids like to congregate, but we do try to keep them apart. Also, we do continue to clean and sanitize after each group is worked out. Just for instance, if we have an open gym for basketball, they're in groups, and then we also sanitize the basketballs and things as we go through that. Same thing with volleyball. Everything is cleaned and sanitized after each practice and each group that comes in.
Okay. All right. I'm going to give Cameron a chance to address some questions. We had some questions come in from some of you beforehand, and some of them were business office related. So I'm going to turn it over to Cameron and let her answer some of our updated financial policies.
Yeah, I'm Cameron LeBlanc. I'm the business director here at Legacy. I received a lot of phone calls after over the last few weeks with questions about our financial policies. So I wanted to give just a brief overview of those policies, just as a reminder to everyone who's returning and those of you who are new. Our policies are remaining largely unchanged with a couple little tweaks. So our policy for tuition is that you have 2 weeks into the semester to determine if you would like to continue at Legacy. So what that means is if you decide within those first 2 weeks that this is not the right fit for you for any reason, you can withdraw and you are not responsible for the tuition for the remainder of the year. With that said, you will lose your $500 per student deposit if you withdraw within those 2 weeks. So outside of those 2 weeks, if you decide that you would like to leave, you are responsible for the full year's tuition. This is why we strongly encourage you to purchase tuition insurance. Outside of that 2 weeks, you can file a claim for tuition insurance, and it will cover somewhere between 60 to 80% of your remaining unused days of tuition. So we really are encouraging people to take that out this year. You still have time to do that. You can actually purchase it up until the very first day of school. So if that's something that you have not done and you're interested in doing it, please contact somebody in the business office and we'll make sure that you're all squared away with that. Another question I've been getting a lot is in regards to enrollment fees. So enrollment fees are paid somewhere between January and March. Those are non-refundable. But what we are going to change for this year is if you withdraw and you would like to return in January, you're not going to have to pay an additional enrollment fee. Now, there's a little caveat there. We may not have space for you in January. So that is what we would like to do and intend to do for you. But it's really going to depend on, do we have space in the classroom? Do we have enough teachers to accommodate any students who are wanting to come back in January? And this year, space is more of an issue than ever because we're trying to social distance and keep kids apart. So even though in the past we may have had space for your student, we may not have space for them if they're trying to return in January, but you can always contact us and we can see if that's a possibility for you. The other question that came up in the spring, and of course is a question this year, has to do with what if we get to that phase 5 situation where we are completely virtual. If we are completely virtual and we're still providing lesson planning, grading, and some type of instruction, whether it's through Zoom or through videos, you are still going to be responsible for tuition. The reason for that is, we run pretty lean here, and our teachers, even though they may not be in the classroom instructing, they're still the ones behind the scenes who are doing all that lesson planning, doing all that grading, and a lot of cases, especially in the upper school, they are actually providing you with a lot of instruction through Zoom or Teams meetings. So if that's a concern for you, it's just something to think about, that is a possibility. We hope that we don't get there, but it will run very similar to what we did in the spring, and our financial policies will stay in place. I'll go back to Audra.
Okay. Guess we're kicking it back to me. Okay, I think I get to wrap it up before we start answering some of your questions. So my part will include a lot of the emails that I've received as well, and so let me start with some of that, and it may not make 100% sense the way that I go, but hang with us. So first of all, I just want to remind you that our theme for the year is fearless, not reckless. So I've gotten a couple of emails about, what does fearless mean, this or that or whatever. Fearless just means it's going to take courage to come back on campus because we've been gone for far too long. So, we're as Miles prayed tonight, we need courage, we need wisdom, and so we intend to be as safe as possible. Your children's safety is our utmost important to us, and so we're doing everything we can to make this place safe for them, and I'll talk about some of that here in just a minute. So safety first. I guess I may as well hit that now. We've got a lot of questions about masks, so let me clear that up for you. We are going to follow Governor Abbott's mandate, which says that children under the age of 10 are not required to wear masks, while children over the age of 10 are. So what does that look like on campus? Well, 5th grade and down will not be wearing masks unless you want your child to wear them. If you want your child to wear a mask, by all means, send them with a mask. As Tanya said, we're not going to be running down the hallways ripping masks off of people. If you want your child to wear a mask, wear the mask. For our children that are older, they will be required to wear the mask as they enter the building, as they transition to classrooms. If they're in a place where kids are gathering, if a teacher needs to approach to ask a question, they're going to be required to wear the mask. And the way that we've looked at this for middle school and high school is that the mask is part of the uniform. It just is, at least until the governor decides otherwise. We are going to treat it, like I mentioned in the video, much like a restaurant. So because we're able to space these chairs out, the desks out in the classroom anywhere from 3 to 6 feet, once the students are in their seat, they can take their mask off. Now, if there's a situation where, let's say in math class, a kid needs you to come look at a math problem and, hey, you know, Miss Math Teacher, can you come look at my paper? The student will put the mask on, the teacher will put her, if she's not wearing it, will put her mask on, and they'll have a conversation. If the child doesn't want to put a mask on, then the teacher is not obligated to come within 6 feet and have a conversation. And that's for the protection of, as I mentioned in the video, of our staff, who really are probably more at risk than most of our students. What we've kind of designed in the classroom is that there's a 6 to 8 foot space between the touch screens and the whiteboards and where the desks are. So if we have teachers that want to teach without an actual mask on, because it's going to be hard for students to hear, then they are allowed to do that. The majority of our teachers have opted to wear the face mask so that it's clear and so that you can see their facial expression and the kids can clearly hear them. We do have a couple of teachers who have some health conditions and they want to wear the cloth face mask. Some of those teachers are purchasing mics so that you can hear so the kids can hear them speak. For the most part, I believe our teachers will be wearing some sort of mask, whether it's cloth or face shield. So that should answer some of the questions that are up there. So let me cover, secondly, I've had questions about what we're actually exempt from. The governor is very friendly to private Christian schools. And he's gotten a lot of grief lately, but I've got to give him kudos. There's so much going on that is not public. So he's fighting a lot of things. But what he has done is make sure that religious liberties are protected in the state of Texas, and that includes private Christian schools. Were it not for him, we would not be able to open with people on campus on August 17th. Don't wait till October to come. August 17th. So let me just tell you where we stand right now. We know the governor's order, has the face masks and the ages. Okay, so let's move past that. The teachers' unions it is widely known that they do not want to return to campus, yet they still want to be funded. So once the governor issued his order, he states that you're to be back on campus offering options for families to go in person. Some of the surveys that I've seen from CISD and Montgomery have been 75% of families who responded to the survey want to be in person. So we know our people want to be back in school. Parts of the teachers union do not want to be back in school, whether it's fear for their safety or this is going to be impossible or what have you. And so they've worked to circumvent the governor, and if they can't use their local county judge, now they've gone to the health departments, which is why Ken Paxton, the Attorney General of Texas, issued the letter saying that private Christian schools are exempt, not from wearing masks, but they are exempt from the order of the health department that says we cannot go back to school. So I want to stop there for just a second and just read you a part, I can just tell you a part of the order from the public health district. Their letter basically said that even in public schools, small numbers of students could be on campus and that they could continue the extracurricular activities that were already going on in intermittent ways. Well, we already do that. We're in school intermittently. Our groups are small. And so really the public health order that went out is really just, it's more of a guideline than it is an order for us. So hopefully there are some public schools that will actually do that and maybe have some sort of hybrid that allows students to be on campus. So I just want to make that clear. We are not exempt from the governor's order to wear masks. We are exempt from the health department's order to basically cease and desist and not be back in the school. So just let me make that clear. That is not what we're exempt from. There are laws that we have to follow. In saying that, I want to let you know too that the reason why we're asking all of our teachers and all of our families to sign the waiver, because I've had some questions about the waiver. Public schools are protected from lawsuits in cases like these that are health related. Private schools are not. And so Legacy takes a risk just like every other private school in the Woodlands when we open our doors in the middle of what is a health crisis. And that is why the waiver is there. And like I mentioned, the waiver says basically that that there's no way we can keep people from getting the virus, but that we're going to do what is reasonable and feasible to keep people safe and to keep them protected. And so you have our assurance that we're going to do that. Those waivers are going to go out for an e-signature. You don't have to print those off and turn those in. Those will go out soon, and you can just click on the dotted line and sign those. I will add too that the TEA has been through their guidelines has ordered and provided a lot of our health equipment that we're going to be using as school starts. We have 48 gallons of hand sanitizer. I don't know what we're going to do with all of it, but I'm sure we'll figure something out. Hundreds of masks. We're going to actually be able to give some of our students a couple of masks because we have so many. And then we'll be giving masks to our teachers so that when the kids need to go see Tanya, for instance, if they're in elementary, we have a little pediatric mask that they can wear. So we've got masks, Clorox wipes, hand sanitizer. All of that came from the state through Governor Abbott's order. So we do have a lot of equipment on hand to help keep the place safe. We've also added 30 different stations of hands-free sanitizers. We're spacing out the rooms. The other thing I wanted to mention that we're doing is assigned seating. And this was something that we read about. I think it was a university that was doing this. And so every class, the kids will have assigned seating. If we have a student that gets sick, then we can look at the seats around them and sort of do our own little contact tracing and saying, hey, this child has been sick. We know who sits around them. We know who sits in those desks in the previous classrooms. Smart. And so we'll be able to reach out to our families that way and say, hey, your child's been exposed in this way. So without revealing the name of the person that was sitting there, we have to keep that private. The other question we've been asked is whether or not our policies will be published. Yes, we actually have them written. But as Tanya stated, the guidelines have changed, and not only that, you have differing opinions from the Pediatric Society, the CDC, the TEA, the Health Department. All of them are conflicting, and so we're going to have to choose one, basically. We think we've landed in a spot that we're comfortable with, and so we'll have those published by the end of the week. They're basically ready to go. We're going to add a COVID addendum to our health policies in the handbook, and then we will get those policies out where you can see them. The TEA essentially requires us to have those out no later than 1 week before school starts, and so we will definitely get those out and put them on the website and send them out to you so that you will have them. I wanted to give you a quick update. I've had this question asked, what is our enrollment? It is down. Last year we ended with, I think, 53 students. We currently, as of today, are at 423 students. Now, that doesn't sound like a lot, but if you average our tuition to say around $10,000 a person, then you're looking at $250,000 of income that is not rolling in to Legacy. Add to that the amount of money we've spent purchasing different items to make sure that your kids are going to be safe. Cameron's rubbing pennies together, and she says no a lot more often than she used to. So anyway, the numbers don't look terrible. I think we'll get close, but as Cameron mentioned also, it's not just number of kids anymore, it's number of kids we can fit in a class safely, trying to keep them separated. So if you pull your child out, it's not that the number, we may have too many kids, the problem is space. We're trying to keep them spaced out. So if you pull out, you do lose your spot, you roll back in line. For every child we lose, we literally get another 1 or 2 in. Lots of kids from families from public school who want to be on campus and in the classroom when school begins. So there's an opportunity there. One of the questions we received was, what are we doing for children who may have like grandparents in their house? And the answer to that is the same thing we're doing for every child. We can't make special adjustments or modifications. We're trying to protect every child. So if you have a child that's living with an older adult in your home, you need to take extra precautions for that. Otherwise, we're doing what we do for everyone else. Maybe that child wears a mask the whole time. You can call us and talk to us about it. We'll be glad to try and work something out with you. But other than that, we're doing the same thing for basically every student. Lots of questions about our phased learning, like when would we go to phase 4 or when would we go to phase 5? So for phased 4 learning, that was our hybrid of a hybrid. That means that we'll have less students on campus and most of the kids will go to 1 day per week on campus. In talking about when we would do something like that, we are thinking about basically the way that we did school when swine flu, H1N1. I was trying to decide which descriptor I wanted to use when that was here. So basically our policy at this point is like it was with any other communicable disease. When 30% of our school population either has it, been exposed to it, is out with it, and we need to, close down and have even more space between us and less kids on campus, that is when we would move into phase 4. I don't see that happening, but that's when we would talk about phase 4. The only reason that we would move to phase 5, where it's total distance virtual learning, is if the governor shut us down. That's it. Otherwise, we're going to be on this campus, either 2 days, 3 days, or 1 day. But we're going to be here. So that's what we're using as a standard to determine that. Distance learning for our elementary kids is we've learned a lot from the spring. That's going to be a lot different. Be sure to view Ms. Bontrager's video and the other principals' videos for specifics on that. And we've also sent out a handout for that. So we got a couple of questions about that. The last thing I have on my list are volunteer hours. If you, so as we've stated, parents, we're allowing no visitors during at least the first quarter. We're entering into the school in phase 3, so limited visitors, kids social distancing, masks for our older kids. So what about volunteer hours? So for every quarter that we have no visitors on campus, your volunteer hours are reduced by 5. So starting with the first of the year, you're only responsible for 15 of the 20 volunteer hours. If we go into the second quarter, your volunteer hours are cut in half by 10. So we felt like that was probably the best way to accommodate that. We're still going to need help in some places, but obviously if you can't be on campus, that limits your ways that you can volunteer. Let me make sure that I've answered these other questions. Additionally, considerations. Staff and faculty will be wearing masks, remote learning. Okay. I think that I've covered everything, all of the questions that were asked ahead of time. I think everybody on the panel that has spoken has covered the different questions that you've asked. All right, and so now comes the fun part. We actually finished a little early, so we've got time for questions, and we'll try to get to all of them. Carson has put me in charge of technology, which could be a really bad mistake, but we're going to see what we can do here. Okay, moving up. So this is probably for Tanya. If they're wearing a mask and they're exposed to someone that has COVID, do they still need to quarantine for 14 days? If so, what's the point of wearing a mask? The all-encompassing mask question, Tanya.
I know. So I can only go by what I was told when I talked to someone at the Montgomery County Health Department. They said we only quarantine those that are considered high-risk contacts. The definition of a high-risk contact is someone who was within 6 feet of the person who tested positive for more than 15 minutes without a mask. So that's what we're going to have to work with the health department to decipher who was in that criteria. That will be the ones that will have to quarantine for the 14 days to watch for symptoms, according to the health department.
All right. Will the middle school and high school students have to wear masks all day? I think we answered that. Anytime they transition, yes. If they're sitting in their seats, no. Unless you want your student to wear the mask. And of course, like I said, we're not going to be ripping masks off of people. So yes, they can wear their mask seating or they can take them off.
And if they're outside for recess.
Oh yes, outside for recess, they do not have to wear masks unless they just want to. Why can't I make this go down, guys?
Push the arrow.
I did.
Hit the arrow, maybe.
I think you gotta be in the dark blue area.
Oh, there's an arrow on there. My bad. I told Carson this was not a good idea. Okay, if a student needs to quarantine for 14 days for COVID, self or sibling, will there be any available options to view classroom teaching remotely? Yes, thank you, great question. Okay, so if we're going to treat COVID absences as an excused absence, whether it is for the child that has COVID or the child that is related to that child that has it but doesn't have it. The TEA guidelines say that students must attend 90% of their classes. For the university model, it's 80%. And so because of COVID, now what you do at home also counts as being in attendance. So if your child has COVID, obviously we're not, and they're ill, then we're not expecting them to, work. There'll be late work turned in later. But if your child is quarantined at home because one of your siblings has COVID, then they are required to get online for the Zoom meetings and work remotely. Now, opposite of that was a question that I got earlier. Will there be an all virtual option for kids that don't want to come back to campus? The answer to that is no. We don't have the resources for our teachers to do both in class and virtual. There's no way to do that. So if you need an all virtual situation, we're not going to offer that unless your child is dealing with COVID, being quarantined, etc. So hopefully that's clear. Oh, that's just a sweet comment. So sweet. Okay, how will lunches be done? Oh, okay. So yes, we figure a lot of you are driving through and getting your Chick-fil-A and your burgers. And so if you can do that, then you can certainly have lunches here on campus. So we will continue to offer lunches. We have a plexiglass screen that is in front of our cafeteria. So as they're serving, there's a screen in between the kids. Gina has put down vinyl dots on the chairs in the cafeteria, and so it will space out. The kids can only sit where the dots are, so they'll be spaced out. Now for elementary, what we're going to do is we're going to split elementary. So where they would normally all eat together, one grade will go outside and go to recess first, and that will allow us to spread out the other kids. And then when they're done, they're going to switch, and the class that was eating goes outside. The class that was outside comes inside. We've also purchased a whole bunch of outside eating places, but picnic tables and umbrellas, so the kids can go outside and eat. They can go to the gym and eat. We really would prefer them not to eat in their classrooms. So we're going to keep them as spread out as far as we can in the lunchrooms for elementary, middle school, and then for high school. Okay, just want to make sure I covered all that. Did the board consider surveying the student body's parents regarding their concerns on reopening? Which one of you wants to answer?
Yeah, I can take that. So what we did look at and consider is one, kind of re-saying what Audra has already said, which is we're going to follow what the governor's mandate is at this point. And then it's up to each individual family as to whether they feel that it's safe for their student to be on campus or not, and to be able to move forward with learning here at Legacy.
Okay.
I think I'd like to add one thing to that is the response that we've had as a school and social media, etc. People are excited to send their children back to school on campus. We've had a lot of really positive feedback. Just wanted to add that.
Yes, overwhelmingly positive. I would say I wouldn't even give it a percentage, but overwhelmingly positive. People want to be back on campus. Okay. Board consider parents move forward ordering, yes. Move forward ordering uniforms and computers, yes. Max number of students allowed in the elementary classroom. Lisa, do you want to answer that?
Yes, that is a max in the homerooms of 16. Most classes haven't capped out at that at this point, but 16 is the max for homerooms.
Okay. What is the Zoom meeting for the quarantine kids? Is it live streaming? No, it will not. It most likely will not be live stream teaching. Of course, I need Shannon or Amanda here to do this, but we're going to treat it as an excused absence. So they'll just receive their work like they would if they, were sick otherwise. Same with the kids that are being quarantined. Now, we are looking at some ways to video all of the teaching sessions. We're not sure how that works just yet. We have purchased additional True Touch TVs for a lot of the classrooms, and I know that there are ways to record some of that. But I don't know if it can record every class. I do think we're going to try to do some of that. I just don't know if it's going to be able, so we're still working on that, but know that that may be something that we're capable of doing. Did I answer that correctly? Did I leave anything out? Okay.
I think so.
Are any masks acceptable? Okay.
Yes.
Yes. In fact, what we have seen is the boys really like the net gaiters that come up over their faces, that they played cops and robbers with, or does anybody play cowboys and Indians anymore? But it's what we used to do, play cowboys and Indians. So yes, you can even wear the net gaiters, which has actually been really convenient because you just pull it up as you need it and pull it down as you need it. So yes, cloth masks, net gaiters, as long as it doesn't have inappropriate messaging on it, it's acceptable.
And the North Store is offering neck gaiters and masks.
Yeah, you'll have plenty of
With a logo.
Legacy. We feel like if we gotta wear them, we can advertise with them.
The TEA definition is non-medical grade disposable face mask cloth face coverings. They must cover the nose and mouth, or full face shields that protect the eyes, nose, and mouth. So it can be of any of those type. The point is, it's kind of goes back to what we've been saying about the flu for years and years and years, to cover your cough and sneeze. That's really what the face masks are for. Any forceful expirations, just sitting and quietly breathing and talking quietly is not necessarily considered a major spreader, but the coughs and the sneezes are considered the major spreaders if you are an asymptomatic person. The other thing I will say is it's important, and it's going to be important for all of our students, to wash your masks. So make sure that you're washing your masks on a semi-regular basis.
Like your uniform.
Yeah.
Wash it with the uniform. There you go. Okay.
So parents providing.
Yes, parents, you will provide the mask. What we do have extras in case the kids forget it, but those, I don't know how long we'll have those. And then also for our elementary kids who maybe don't bring a mask, we'll be able to provide them a mask if you want them to wear one for as long as we have the supplies on hand. How many days will 11th and 12th graders be on campus? 5 days. Their schedule should stay the same. And this is a good question as well. Got information from Lone Star today. All of our teachers from Lone Star will be on campus. I don't know what they're doing, what Lone Star is doing in general, but all of our Lone Star campus dual credit teachers, they will be here on campus. We do have one teacher that may do online, and she may split up like our Tuesday, Thursday class. She may have one half of that class come on Tuesday and one half come on Thursday. But to my knowledge right now, they have all agreed to come on campus and do this live. So that's good news.
I think we're here with the portables being smaller.
The portables being smaller than the main building classroom, will the same spacing be possible? Yes, we've been trying to, those rooms especially have gotten extra treatment. So we have, we're purchasing air purifiers, we're purchasing humidifiers, we don't want a humid. Dehumidifiers. They can leave their windows open. They can leave their doors open. We're a little bit uncomfortable with that and safety. There may be other ways that we can do that, but that is what's recommended, is to let as much fresh air come in. We're also encouraging our teachers to take the kids outside, which the TEA recommends as well. So we have those options there. And again, that's the issue with the spacing. We may not be able to accept as many kids because we're spacing them out. The other thing that we've done is ordered additional desks so that they're not sitting at tables, and the desks will keep them a little bit further apart. So they're kind of a hybrid of desk table. They're like anyway, we'll send you pictures of them. Okay.
Okay,
What will the
Procedures.
restroom breaks? Okay. So what we've determined as far as going to the bathroom is that as many students as our stalls can be in the restroom. So if there are 3 stalls, there can be 3 students in the restroom. We'll have signs on the restroom doors that say if you open the door and every stall is full, you should stay outside until a space opens up.
Okay, you're right here.
How will social distancing be maintained at recess if it won't be when all students? So according to the TEA, unless I'm wrong, Tanya, they're not required to wear masks outside due to the UV and the fresh air and all the other good stuff. But I'll let you, if I'm not right on that, I'll let you.
I don't know where that is
Okay.
in my thing, but yeah, they say if you're outside, but we're, as monitors outside, we're going to
Yep.
not let people huddle at recess.
No
either.
huddling.
No huddling.
And we did find out that we're not necessarily required to clean the playground equipment out, to disinfect the playground equipment outside because of UV and other things like that. So, but we will be wiping things down, making sure the kids have hand sanitizer.
And they will wash when they come in from
Yeah.
recess.
Lots of hand washing going on. If everyone will be wearing a mask, would you be willing to provide parents a book of employees with names and pictures so we know who's with our children? Let me think on that one. I don't know why we couldn't do that. Most of our teachers will be wearing the clear shield, so you'll be able to see them. And I will say I got some pushback when I mentioned in my video that masks are fine until they become a safety issue. That's actually in the TEA guidelines as well. It is a safety issue, which is why I personally don't like them here on campus, because we can't see the face. I actually ran into 2 students at the grocery store the other day who got onto me because I walked right past them because we were all wearing masks and I didn't recognize them because they'd grown 2 inches since the last time I saw them. So it is kind of concerning that we can't see all of their face, but that's the point of the uniform. So yeah, that's actually an interesting suggestion. Let us look into that.
We also think our staff pictures are on Prexy.
I was just
Under
gonna
the
say.
Are
names.
they? Okay.
Names and pictures.
And the yearbook, if they
Okay.
have that, is a good
Should we
resource.
also take the picture like, okay.
Okay. Car rider.
Car rider line. Okay, I may let you do that one because I can't remember what we decided.
Okay, so we talked about several scenarios, but we're gonna leave it as normal. So again, we have 2 campuses, so I'll talk mainly Tuesday, Thursday is pretty easy. We're gonna just do drop off at the front and pick up there as well. And then Monday, Wednesday, Friday, we're gonna do car line the same as normal on the side of the gym. All the attendants to unload the kids will be in masks to help the kids get out of the car. And so what we decided, elementary is gonna be in the lunchroom, and middle and high school will go to the gym. But we're only gonna hold them there for about 15 minutes. We're gonna dismiss. The lunchroom holds about 66 kids, socially distanced, and the gym will hold about 120 if they're seated. So we figure within the first 15 minutes, we're not gonna have quite that many kids at that time. So at that point, we're gonna release them all to their classrooms. And then they'll be in their classrooms. They'll do prayer, pledge, morning announcements, and all that straight from their classrooms. Is that good?
Yep.
Okay.
And now on their dots.
Oh,
Wow.
is that all?
Okay, so before we end, is there anything that you guys can think of that we should cover that we haven't covered? No?
Not that I can think of.
Wow, we're so efficient. Okay, all right, so good. We're gonna be finishing early, are we early? Yes, we're gonna be finishing early. So I guess let me just end by saying that we're really excited to start. We've been ready to start since spring break. This has been the longest spring break ever. I've run into a lot of my sweet basketball girls, and they're ready to be back on campus. Even my kid said he was ready to be back on campus, so that's saying something. So we're excited. We're making plans. We're going to do the very best we can to keep your kids safe. It's our number one priority as we go back to school. We just really ask for your prayers and just thank you for your encouragement. Keep your questions coming if you're concerned about anything. Like I mentioned, we'll get our policies out probably by the end of the week. We're waiting a little bit on the CDC, who's been really stubborn about getting their information out. But I think we've got a good feel after Tanya spoke with the health department the other day about which way they're going. Yes, just saw the last question there. Are we still expecting to start in phase 3? Yes, we are starting in phase 3, and you can read more about that on the information that went out. I think that's it. There's nothing else? Okay, thank you to the board for coming tonight, and thank you to my admin team and to everybody who's been working so hard. Thank you to our families, and like I said, if you have any questions, feel free to reach out to us, and we'll do our very best to get you the information as we know it. So, looking forward to seeing you guys soon. Good night.
Mhm.